Hi, my name's Richard Fijo and I am the Senior Cross-Cultural Educator at Northern Territory General Practice Education. So currently we're at Kakadu and we're on our Cultural Immersion Camp, and we're holding our Cultural Immersion Camp at Kakadu Billabong Safari. Well, I think the Cultural Immersion Camp is quite unique because what we do is we work with people who actually live on the land and work on the land, and so we go from Darwin as the capital city and we can travel out to Kakadu and we talk with the traditional owners, and we organise to bring our doctors out there for a 4-day cultural immersion experience. So while we're out here, they'll learn about things like kinship, skin names and family ties, and how communities run. And while we're out here, we'll also try and give them exposure to some of the cave paintings that are around the areas. We talk about creation stories, dreamtime stories, and present a whole new worldview about the way Aboriginal people practice their culture and in their communities. So in regards to our programs, we've actually talked with some of the local traditional owners and rangers, and we've actually compiled between us a set of activities that we find will benefit our doctors and our attendants for the Cultural Immersion Camp. Some of these things will include family interactions while they're out here. Some of them will include bushwalks, looking for bush foods and medicines, rock arts and storytelling, but not just storytelling about the place, but also origin stories about the spirits of their land. So it's really important when we go to these type of places that we have a welcome to country, and the traditional owner performed a freshwater ceremony to welcome us to country and called across their country in their own language to make sure that the spirits of this land know who we are when we're here as visitors. We're also looking at cooking up some kangaroo tail in the traditional methods, so on the coals. We also managed to bring some magpie goose, and that's also going to be used and utilised in the traditional methods. In previous camps we've eaten things like snake and fruit bat, but we want people to have a really enjoyable but broad experience of what it's like to live in the communities. So part of that will also include visiting remote communities and looking at clinics in town and comparing that to clinics that are on remote places. Being culturally aware is really important to GPs in the Northern Territory because predominantly Aboriginal people are the majority of our patients. We're the most disadvantaged people in Australia, and we're the most people in need of health. And so we need to provide services that are culturally safe. And that means when we train our GPs, we're training them into the Aboriginal lifestyle, into the Aboriginal beliefs, because we're introducing them to the world of Aboriginal culture. And through having this understanding, they can able to establish a better doctor-to-patient relationship. So I think that the Cultural Immersion Camps is a good opportunity for medical professionals to learn about Aboriginal culture, because it takes a step up from theory learning. It takes a step up from reading in books. It takes a step away from the classroom, and it actually places them in remote communities where they will be actually sitting by the campfire with Aboriginal people from remote regions, listening to their stories, listening to their knowledges, and having first-hand experience of what it's like to be right here